Hi, I'm Elizabeth Hess. I'm here with Julie Pryde. She's the administrator of the Champaign-Urbana Public Health District. Good afternoon, Julie.
Good afternoon, Elizabeth.
There were some more protests all over the country this past weekend, in addition to the ones that happened last week. Do we wait 6 days and get a COVID test, or how should we handle this now?
Well, we're asking anyone who was at the protest to yes, isolate or not isolate, but quarantine yourself away from others, especially anyone at high risk. And then if you have any symptoms whatsoever, go get tested immediately out at the mall at the free drive-through community-based testing site, or wait about 5 to 7 days and then go ahead, symptoms or no symptoms, go ahead and go out and get tested as well.
We're going to get back to COVID, of course, because that's why we're here. But one of the things people were marching about was gun violence awareness. Gun Violence Awareness Day was the other day. Isn't this, and hasn't it always also been, a public health issue?
Yeah, gun violence is a public health issue. Systemic racism is also a public health issue. So when we have gotten a lot of questions from the public, and I get that, saying, why are you allowing protests, but you're not allowing church? First of all, we don't allow anything. We try to put out guidance, and the governor's executive order is saying where we are in the phase and the reopening. But there is something different about protests as opposed to actual organized events. And the deal is this, that we, just like public health did not go out and try to stop protest when people were out protesting, not wearing masks, and protesting, insisting that the government reopen or the executive order be killed during the beginning of this. We wouldn't also try to stop other protests. Protests tend to emerge. They're not planned in the typical sense. They emerge based on a cause. And systemic racism and violence against people of color is absolutely something that is an issue, a public health crisis as well, and it always has been. Health inequities spring from inequities. So in public health, we call them, health disparities. In schools, they refer to them differently, but it all gets down to structural racism. So that impacts people's lives, and in everything from education to healthcare to employment to incarceration. And those are everyday stressors and everyday situations that impact people's lives negatively. And so in this situation, what public health tried to do, CU Public Health tried to do, is put out guidance to make it as safe for people to go out as possible. So that was wearing masks, of course. And if you noticed any of the pictures or videos, you saw that there was almost universal mask wearing. It was shocking how many masks were out there. It also is to try to protest in a group with your own cohort. So go out there with your family unit or your household and try to social distance from other people. There was some of that going on, and you can definitely see it from the drone footage, but you can't really see it from the front photos. And then to also do not protest if you're sick, do not protest if you are a person who is at risk. Stick to the edges, passing out water or something like that, or do something online, or write letters, or do something that does not expose you to the virus. So a couple of things will hopefully keep the numbers down from these protests. And of course, we are going to know in the next couple of weeks. One is the almost universal mask wearing will help a lot. And then the other is that it was really humid out for both of the protests. Why that is helpful is because your breath, is water. So the little water molecules come out and you have the virus. It's very tiny. But then the water molecules attached to humid air, water molecules, they become heavier and then they fall. So they're not suspended in the air for you to breathe them in as much. So with the mask keeps it in, and then if some does get out, then it will be more likely to fall. And that has to do whether you're at a protest or whether you're just outside at the picnic or whatever. Humid summer, hot and humid weather helps to keep virus transmission lower, but you still need to mask and you still need to maintain some distance.
So the main differentiation between going to a protest with a mask outside and going to church, but you're still wearing a mask, is that you're inside and there's not as much humidity. And would you say that's the main distinction that makes it less safe to be inside with your congregation?
Well, there's a lot of issues that are specific to infection transmission inside facilities, and that's touching common surfaces. Actually, when you're inside, humidity works sort of just the opposite. So it's not hanging in the air, which is a good thing, but it is dropping faster and it's dropping onto commonly touched surfaces. So, but there is guidance out there, and places are holding church or services. They're doing it differently, smaller groups, just trying to keep people away. One of the issues, too, is that some places are not reopening the normal way, back to normal, because they have a lot of people in their congregations or their groups who are at risk. So that is concerning, too, because ultimately then, that if you have an outbreak and people die, that's concerning. And I think that weighs heavily on a lot of people who are making these decisions locally.
Reopening this week, the YMCA's pool. It's a very humid surface, a pool's deck. It's indoors. The locker rooms are closed. You can't have any water. You have to leave your belongings in a bin. What do we know about chlorine and COVID transmission?
You're not going to get it from the water. Certainly, that's not a concern. Early on, there was a concern about the virus and fecal shedding because they know that it is present there, but the chlorine will take care of that. I mean, there's all kinds of stuff that can be transmissible within pool water, and that's already controlled for by the chemicals that are put into the pools.
Okay, one of the things we've talked about in the slow reopening process is not overwhelming healthcare and the spread in nursing homes. Here are some stats according to the Illinois Department of Public Health. The deaths at long-term healthcare facilities constitute more than 52% of those in the state. The federal numbers show at least 31,000 COVID deaths among residents in U.S. nursing homes. Are we in line with the rest of the country? Because our numbers, that sounds pretty high.
Well, that is pretty high. Luckily, knock wood, in Champaign County, while we've had cases in long-term care facilities, it would appear that the infection control practices that they implemented really early on seem to be holding, and we hope that continues. It's really hard, and it's a lot of things that are it's really hard to do. I mean, not getting to see your loved one who's in a long-term care facility. There's not a lot of physical contact. It's very hard, but they are so vulnerable, and long-term care facilities as a congregate site with a lot of high-risk people are just very, very vulnerable locations. And so there have to be really stringent measures to prevent it from getting in there, because as we've seen all across the country, once it gets in there, it can be devastating.
In general, where are we right now with active cases, recovered cases? I know you keep very close stats.
Yep. Well, right now, which I think is kind of exciting, is we're up to almost 19,000 cases, or 19, that would be bad if it were cases. Almost 19,000 tests have been completed. There have been a total cumulative number of 686 cases, and 97 of them are active right now. We haven't had this low of an active number in a while, so that's good, because every active case means it's a person who's currently infectious and is in isolation, and there's a lot to be done with those cases. We follow them up every day. We contact trace everyone associated with them, put them in quarantine, and then follow them as well. And right now we have 6 individuals who are hospitalized.
Okay, right now I need to come out of hibernation and get my annual physical. My son needs his booster shots. We both are 6 months delayed in dental care. When we go to offices, should we expect temperature checks? Should we expect them to ask if we have symptoms, if we've traveled? What are the questions we should expect?
Well, when you go in to, let's say, a healthcare provider, well, anything really, when you go in there, you're going to be asked if you have any symptoms of COVID. They'll go down the list of them real quick with you. They'll ask about fever. You will have your temperature taken, maybe not until you get into the room, but you will have it taken. If you're going in for some type of a procedure, they will ask you to test prior to coming in and then isolate and test again and then go in. But really for a lot of these, a lot of the places, it's okay right now to go in and start getting some of this stuff taken care of. Definitely immunizations. Kids and adults need to make sure that you go ahead and get your immunizations. That is something that can be done relatively quickly without a lot of risk to the patient or the healthcare provider. So definitely get those done. Dental care, depending on what's being done, that can be a high risk for the dental hygienist or the assistants or the dentist. So they're really more at risk. So those places are opening once they're able to get enough personal protective equipment to make sure all their employees are safe. But if the places are open, your dentist, your eye doctor, your going in for your annual exams, whatever, if they're open to do it, they're equipped to handle you coming in. So go ahead and get those done.
One of the aspects of public health, the word health covers mental health. We've experienced every emotion over the last 3 months. And as 41 million people are in unemployment, we have depression, we have a lot of anxiety. How is the public health department helping people deal with the emotional aspects of this virus?
Well, I don't know that we necessarily are, except for trying to put out as much information as we can to make sure that people have timely, accurate information on which to base their own personal decisions on, and to link to resources. So in our community, the community came together really early on and decided how to push out information. So the 211 system that is being used by, they're sponsored by United Way. That's a great place to call right off the bat. If you have any questions or need anything, call there. There are all kinds of different places out there providing services related to mental and emotional health. And I know a lot of the faith-based community have started, reaching out to their congregations and checking up on them. So there's a lot of resources out there. I wouldn't, public health, all we are doing is letting people know where they are. But first stop is 211. Call in there if you have a question about anything, and then they will point you in the right direction.
211 is where the university website directs you. And yesterday I was on the university website, and one of the things that they say is that in late June, they're going to be discussing whether or not they can reopen or how education is going to look in the fall. Is there a scenario where we are doing remote learning again this fall?
Yes, I mean, everything is on the table because the virus dictates, what we do everywhere pretty much. What typically happens in pandemics of a viral nature, like let's say 1918, what happens is you do have the summer lull for a variety of reasons. And so people tend to start letting their guard down. And then once, fall gets here and then winter and people are inside and we've got other viruses going around, it can quickly overwhelm a healthcare system. So our number one concern is that every single person 6 months of age and older that is capable of taking a flu shot this year, get the flu shot, get them as soon as they're offered, because we cannot have hospitalizations and issues, ICUs for both a pandemic influenza, or I'm sorry, a pandemic respiratory and a flu virus at the same time. That would quickly overwhelm things. So everything is based on the metrics and how things are going and how the virus is spreading and what are the cases looking like. So it's just important that people continue to pay attention to the guidance and look at where we are in the different phases and what the information is, and always, consider yourself infectious and anyone you come in contact with infectious. So therefore, keep the masks on and stay at least 6 feet away from people.
I know you're not a lawyer. Let me start by saying that.
I know I'm not a lawyer too.
We forget that you don't know everything. It feels like you do. The businesses that refuse to make cakes for homosexual couples, that was a private business, and the First Amendment covered their rights. If I own a business and I insist that anyone who comes into my store has to wear a mask, that's covered by the same type of concept, correct?
I don't exactly know the legal framework for it, but I can tell you this, that a business certainly has a right, if not an obligation, to protect their employees who are working there. If you run any type of business and you are allowing people to come in there and not wear a face mask, and you have people who are working, closely with them, yeah, that can be a problem. And businesses absolutely have the right to tell people, if you're going to come in and use our services, you need to have a face mask on or a face covering. And there are some stores and businesses around our community who have just done an absolutely stellar job of this. I won't mention them, although maybe I could, but there really are a lot of good ones. And I think that as a community, at some point, we need to recognize these places that are doing such a stellar job with this, because it's not only about community health, which is very important, but it's also about their employees. I mean, you need to take care of your employees. That is important.
Maybe next show we can throw out a couple of local businesses that we've patronized that have been really good at this. I know I've asked this before, but there's now a diagnosed case with a domestic cat. Do we know yet if our pets can pass it on to us or vice versa?
Yep, they actually cannot pass it on to us, but not in the typical way that you're thinking, or I assume you're thinking. So like, you get sick, your cat or your dog can get it from you. That is true. But they cannot then pass it on to another human being through their coughs and sneezes and cuddling or whatever. The issue would be there is a cat could still be a fomite, if you will. So you could cough or sneeze onto your animal, which it would probably not like. And then you could pet the cat and then get that in your eyes, nose. So it's not going to give it back to you through its respiratory coughs and sneezes. But if you do cough and sneeze on your cat, just as if you coughed and sneezed on your phone and you touch that, or your table, and then touch your eyes, nose, and mouth, you can get it that way, or somebody could get it that way. Okay. So we do suggest that people who have COVID, and we always ask if they have pets, and we tell them to wear a mask around their pets.
Okay, I'm going to ask you a question and frame it in a slightly different way, because I know you're sick of me asking the vaccine question. So how and when will you be able to go back to warning us about West Nile and E. coli and Salmonella and all the things? I mean, I know you want your job to be somewhat mundane again. So that's how I'm going to ask it. When do you get to go back to talking about those things?
Well, we will be talking about a lot of those things because we're still doing all those things. So again, we won't be talking about them probably as much because it'll be pushed off from COVID, but I can tell you our mosquito abatement bikers are out right now doing surveillance and working to get the larvicidal briquettes into the storm drains to make sure that we have fewer mosquitoes in our community that can transmit West Nile virus and other diseases. So they're working on that. We hope we don't see an outbreak of that or any of the other, we have Asian tiger mosquitoes as well, Aedes albopictus, and those can transmit, all kinds of things that we don't want to come up here as well. So, we'll still be working on that. But as far as Legionella or meningitis or norovirus, all those things are still out there, and we're still getting cases. And unless it becomes an outbreak type of situation, you won't necessarily hear about it. We have diseases all the time that no one ever hears about. But as far as what the case investigators do, the communicable disease staff, and the contact tracers, all diseases have that process that go with them, all of the communicable diseases. So we're still working on that here, as well as the cases of COVID. But yes, no one would like to see things go back to normal more than public health. I'm pretty sure of that.
All right, before I let you go, one final word, an uplifting, a warning. I like to give you the last word.
Well, I think that, right now things are looking really good. And our community, if you go to any other community, you're going to see that Champaign-Urbana and Champaign County really does a good job with, infection prevention during this time. I can be in a store and see no one without a mask. I see the signage on the floors and the signage and the employees doing what they're supposed to be doing. We see a lot of modeling from our elected officials doing the right thing. So our community is doing a really good job, and our numbers are still low. And even though we've had quite a few outbreaks, I just want the public to know that we're able to handle it contact tracing wise. We have a lot of staff, and we have a lot more staff coming on board and being trained all the time. So, right now we're in a good position, but I do want to warn people that you need to keep thinking of this constantly. It's, even though it doesn't seem like, because people are outside and we're not hearing about as many cases, the virus is still out there. The virus is always just looking for an opportunity to exploit a situation. They don't care if you are in church or if you're at a protest or if you're meeting your best friend in the car to go through a drive-through and get a Coke. Doesn't care. It needs to go from one person to another person to another person to keep being viable and to keep in existence. So, don't let your guard down. People who are more at risk need to really continue on with the measures, and sometimes people don't know they're at risk. So, if you're going to do something, just take all the infection control guidance to heart, because it's there to protect all of us.
All right. I want to thank Jason Liggett. You always put this together and do such a great job. Our producer at UPTV. UPTV is such a great resource in our community. Urbana Mayor Diane Marlin, we always appreciate you letting us do these updates. And Julie Pryde, the administrator of the Champaign-Urbana Public Health District, thank you so much for everything you do.